Good morning. Welcome to the weekly COVID-19 media briefing. I'm Carrie Schutte, the Public Information Officer for the Shasta County Health and Human Services Agency. We'll start out with our numbers. As of yesterday, we had 11,570 cases, including 4 from Sunday, 27 from Monday. We've done a total of 187,081 total tests. We have 6 people hospitalized in Shasta County, and as of the last report, we had no people in the intensive care unit. Our regional ICU capacity is 34.9%, which is an 11-county region, is not just impacted by Shasta County. And we have had 214 people who have died from COVID-19. With us today, we have Robin Schurk, the Director of the Public Health Branch of the Health and Human Services Agency. And standing in for Dr. Ramstrom is Dr. Michael Vivakis. He is our Deputy Health Officer. We also have Robert Folden from Mercy Medical Center Reading and Mark Mitchelson from Shasta Regional Medical Center. Robin, do you have anything you'd like to start us out with this morning?
I do. In Karen's absence, I have quite a bit. So I want to start by making sure that people are aware that we do have another large vaccine clinic scheduled at Shasta College this Friday. It is both for people who received their first dose at the college on March 26th and for people interested in getting their first dose. It will be a Pfizer clinic, which means anyone age 16 and older is eligible. And you can go to shastaready.org and click on vaccinations to schedule an appointment. Or if you're coming for your second dose, you don't need an appointment, just come at the same time you got your first dose and bring your vaccine card. In other news, the FDA and CDC announced yesterday that out of an abundance of caution, they are recommending a pause on the Johnson & Johnson vaccine due to reports of potentially dangerous blood clots. Nationwide, more than 6.8 million doses of Johnson & Johnson have been administered, and there have been reports of 6 cases of this rare and severe type of blood clot in people who'd received the Johnson & Johnson vaccine. So again, it is out of an abundance of caution that this pause has been placed on the vaccine, and we should learn more soon about when we can resume use. The Advisory Committee on Immunization Practices, or ACIP, is meeting right now to discuss the reports and evidence in order to make any further recommendations. The Western States Scientific Advisory Committee has also been meeting to review the situation. And this is an indication that the Vaccine Adverse Event Reporting System, or VAERS, is working, and that the federal government is serious about wanting to ensure that the vaccines are safe. And with only 6 cases out of 6.8 million doses administered, it's also a good reminder that the vaccines are overwhelmingly safe. We have not been receiving nearly as much Johnson & Johnson compared to the Pfizer and Moderna vaccines, so this will not limit our or our partners' ability to get vaccines into arms, but we have had to change course on a couple of specific populations we were planning to use the Johnson & Johnson vaccine with, including our strike team who takes vaccine to people who aren't able to come to a clinic, such as those who are homebound. We can take one of the other vaccines to them instead, but it just means we'll have to go out twice to deliver 2 doses. So depending on what comes out of the ACIP meeting today, we may do that, or we may just postpone those visits until we're able to use the Johnson & Johnson vaccine again. The federal government has said that the reason for the pause is so that they can further investigate these cases and also prepare the healthcare system to recognize and treat these cases appropriately, because the treatment is different from that for other types of blood clots. We and our partners have been using the Johnson & Johnson vaccine up to the point when it was paused yesterday, and we have not been notified of any severe reactions such as blood clots here locally. For people who received the Johnson & Johnson vaccine already, what the CDC is saying is that if you received it more than a month ago, the risk of developing a blood clot is very low at this time. If you received the Johnson & Johnson vaccine within the last few weeks, you should watch for symptoms and contact your healthcare provider and seek medical treatment if you develop severe headache, abdominal pain, leg pain, or shortness of breath. And then on to a different topic, our latest data and tier assignment. Late last week, the state announced that unless there are extenuating circumstances, counties will not move to a more restrictive tier unless hospitalizations are increasing significantly among vulnerable individuals, especially among vaccinated individuals. And both test positivity and adjusted case rates show a concerning increase. So this means that our case rate that had been increasing as of last week would no longer put us in danger of moving to the purple because our test positivity and hospitalizations are low. And because our case rate decreased this week, we now meet the criteria to move to the orange tier, potentially as soon as next week. Our latest adjusted case rate is 5.8 daily cases per 100,000 population. which is down from 7.4 last week. And that case rate was adjusted down from 6.3 because our testing volume is higher than the state's. Our test positivity is at 2.4%, which is down from 2.7% last week. And if our case rate stays below 6 and our test positivity stays below 5, we could move to the orange next Wednesday after our data is released on Tuesday. And that is all I have.
Okay, Dr. Vivakis, did you have anything you wanted to share this morning, or are you ready for media questions?
Yeah, I'm ready for media questions. I think Robin covered that fairly well. I have more information if people want to know about these blood clots. Are pretty complicated and pretty rare.
Okay, excellent. Thank you. How about our healthcare partners, Robert or Mark or Dean? Do you have anything to start with this morning? Okay, well, we will now reach out to our esteemed media representative, Steve Gibson. Do you have any questions for us this morning?
Would that 6 out of nearly 7 million cases be considered, from a pandemic standpoint, statistically insignificant?
So I think statistically speaking, yes, it's an extremely small number, but as I said, out of an abundance of caution, the government does want to look into these cases to see if there is a connection to the vaccine and if there is a concern that needs to be raised with the public. But at the same time, it's a much lower risk as compared to actually contracting COVID if you don't get vaccinated, right? So I think it's still important for people to remember that the vaccines are highly effective and highly safe. And so, yeah, that's what I would say about that statistic.
I would assume that a certain percentage of the population would have a reaction to just about any kind of inoculation. Isn't it extremely remarkable that there hasn't been more negative effects from any of these vaccines?
Yes, the relative risk of other things that we do, we just take for granted, and so a 1 in a million risk, even though this is a very serious side effect and has led to fatalities, at least in one of the women in the United States, is still extremely rare. I mean, I was just looking up some of this whole relative risk thing. We don't want anybody to die from a vaccination or from any other medical procedure that we do, but we know that it happens. But it's more dangerous for me at my age to get a COVID infection than to climb Mount Everest. And I don't know how to pick it up from Mount Everest, but that just shows you these relative risk type of things. An Australian publication said driving 240 miles in Australia in a car is a 1 in a million risk of death. So, but we don't think about that of the other things that we do.
Any other media questions?
Hi, this is Matt from the Record Searchlight. I was wondering if we know how many vaccine doses of the Johnson & Johnson Redding Rancheria has given out and Shasta County has given out.
I do
I
have
have
that.
numbers as of April the 9th for the Shasta County, and it's 3,122 shots given of Johnson & Johnson out of 61,000. I don't know, I don't have Rancheria numbers. They're probably a little over 1,000.
Thank you. Is there any way to tell when the vaccine might get sort of unpaused and people might be able to use it again? Is there any idea of what a timeline for that could look like?
Yeah, so the ACIP is meeting right now and they're supposed to be taking a vote and coming out with further recommendations. So we should be hearing later today. The Western States Scientific Advisory Committee has also been meeting, so they may want to meet again after the ACIP's decision in order to make a determination for California, but it should hopefully be today or early tomorrow.
Thanks. And I was also wondering about what % of our county's population is fully vaccinated or partially vaccinated now?
Carrie, do you happen to have those numbers? I don't have the latest figures in front of me.
I can look just to,
I have something that Daniel sent me. So as of, let me see if I can find it.
I'm right from you, Dr. V.
Yeah, I saw it this morning, and it was okay. Out of the total population in Shasta County, including children, 12% are fully vaccinated. For adults, it's about 16% are fully vaccinated, but overall, it's about 12% if you include all the children, which don't get vaccinated right now.
We've got 26%, Matt, of people 16 and older. No, sorry, 29% have received at least one dose of vaccine of people who are 16 and older, to supplement those figures that Dr. Bubakis shared.
Gotcha. Thank you.
Yeah, of course. Did you have any other questions for us?
I don't right this second.
Okay,
No.
hearing, we got a couple of public questions. The first one is for Dr. Bubakis. Pregnant women were not in trials for medications nor vaccines, yet vaccine is being recommended. Are you pro injecting pregnant women or anti with any of the current options? You're on mute, Dr. B.
My response is that a pregnant woman should check with her own physician. The American College of OBGYN and the Society for Maternal and Fetal Medicine, their recommendation is that a pregnant woman should not be stopped from getting the vaccine if they decide that they want to do it. So the women were not included in the trials, but it's they do have a more, if you're pregnant, you have a much more chance of getting more seriously ill with COVID. And so the professional societies do recommend that women get it if they want to get it.
Okay, and the second question of 3 is, what confidence do you have in the safety of vaccines for 16-year-olds and assurances for parents who are hesitant about vaccines?
Well, in the Pfizer vaccine trial, which is the 2-dose messenger RNA, their trials did do children, teenagers 16 and above, and the Moderna trials did 18 and above. So they were included in the trials, which included a total of over 40,000 people in each one. And I don't know exact numbers of how many 16 and 17 and 18-year-olds there were, but that showed safety and efficacy in those age groups, and that's why it can be recommended, the Pfizer vaccine for 16 and up.
Okay, and then the last question on a similar note is, who decided that 16 to 17-year-olds are eligible for this vaccine? Where is the informed consent for the teen, and where are the full studies on teens?
Well, again, like the previous answer, teenagers were included in the trials, at least the Pfizer trial, 16 and 17-year-olds. If you're less than 18, you do have to have a parent present for consent to the vaccine. So it's a personal choice and a family choice. Children and teenagers usually don't get very sick with COVID, but they can get COVID and they can spread it to more vulnerable people like their grandparents or other people in the community, or even siblings or parents that have health conditions that would make them more risk for serious or fatal infections with COVID. So it's recommended that, if for the vaccine for the age groups that it's been approved for.
All right, thank you very much. Those were the questions that we've received that were related to COVID. Do we have any other media questions before we depart for the day? All right, seeing no green lights, thank you everyone for being with us, and have a safe and healthy week. Take care.